So what do you expect from your first consultation for weight loss? First of all, I'd like to say that that's the most difficult step, making that initial decision to consult a physician about morbid obesity. That is the step that most of all I congratulate most patients for. When you come in, we sit down and we have a conversation, because what I want to do is get to know the person who's in front of me, to try and understand what exactly is their driving force. What is the main thing at the back of their mind regarding trying to lose weight? It makes a big difference. It makes a big difference to me because I like to understand you as a person. And also it makes a big difference because I believe it's not just a doctor-patient relationship. It's a safe place where you can really talk and air your fears, your worries, and your anxieties, so that we can develop a relationship of trust. Now, we look at what your different options are, and that's what I try to do. Go through all your options and then look at your other medical problems and then see if we can come to a decision between you and I. I would never want to force any kind of treatment on you. My inclination is not to decide what is best for you, but my focus is to decide what is best for you after you being able to understand all your options. We look at everything and then we decide together what the best mode or line of treatment for you is. Once all that's decided, we start the process. We do a lot of things behind the scenes to make things easier for you. And very often, I know it can be difficult. I know it can be very long. However, it's just a process. And what I always try to advise is to use that period to learn how to approach food differently, learn how to start those lifestyle changes that you're going to have after you've lost all the weight, especially if you're going to do weight loss surgery. It's very important that you know that there are going to be a lot of things in your life that you're going to have to change after weight loss surgery. The process that we do before the surgery helps you to get used to how to eat, how to drink, how to approach food, and most importantly, how to start gradually increasing the activity in your life so that after surgery, that transition isn't too much of a shock. Not just for you mentally, but also for your body physically. And surgery itself can be a bit of a strain or stress on your body. So beginning to increase your activity before helps to improve your heart and your lung function to make your recovery after surgery much smoother and much less difficult for you. So these are the things that I try to encourage folks to do, especially when they're going into surgery, to start doing in that preparatory process. Trying to make sure that you're eating right, you're drinking right, and trying to understand how the way you eat and drink is going to be very different after surgery from before surgery. Also, trying to let folks understand that the approach after surgery to food, to activity has to change. And you getting into that change, that difference before surgery would make it so much easier after surgery. And it could be something very little like making sure you don't eat and drink at the same time. Making sure that when you eat, you chew your food very well before you swallow. Most of us just kind of eat out on the go, drink really quickly, but these things are things that have to change after surgery. And these are some of the things that you have to work on before surgery. These are the things I try to encourage folks to do while they're getting ready for the operation. Now, even if you decide, okay, I'm not going to do surgery, I just want to do medications and dietary changes. Again, we now guide you through this, trying to get you to understand the right way to eat, how to watch your portions, and guide you so that you're eating right and healthier. These are the things that, as a weight loss doctor, we try to make sure that you understand from the very beginning. I know that initial consultation is difficult. That decision, that step to talk to a weight loss doctor is difficult. But one thing I can guarantee you is that we're going to treat you the way you want to be treated. If you have any questions, if you ever decide that it's time, give us a call and we'll take care of you.